7 foods that increase uric acid levels. When uric acid is present in large quantities in the bloodstream, it can result in arthritis or gout. When it builds up in the fluids of your joints, it causes inflammation and pain, primarily affecting the toes and ankles. Some foods contain a lot of purines that increase your level of uric acid in the bloodstream. Having regular blood tests and keeping a balanced diet are 2 of the keys to preventing this problem. Foods that increase uric acid levels. One, shellfish. Foods from this group should be avoided both in fresh and canned forms, as even the processed shellfish can increase uric acid levels in the blood. 2. Red meat. This is the food that is most commonly responsible for an increase in uric acid levels. You should avoid it completely if you have a problem with this substance. Pork and beef both contain large amounts of purines. Fatty meats, minced meat, kidneys, and viscera are other culprits. 3. Legumes. Limit their consumption to only once or twice a week at most. 4. Certain vegetables. Some vegetables that you should eat in moderation or avoid if you have problems with uric acid include asparagus, mushrooms, cauliflower, spinach, radishes, and leeks. 5. Alcohol. Six. Sugary drinks and sweet desserts. Soft drinks and processed fruit juices contain corn syrup that will stimulate the production of uric acid. Also, industrial pastries, cookies, cakes, and the like are loaded with sugar that will worsen your condition. 7. Coffee. Symptoms of high uric acid levels. When your level gets very high, you experience gout and kidney stones. The most common symptoms include pain in the big toe, intense pain and inflammation in the joints, difficulty urinating, a racing pulse, pain in the knees, kidney stones, fatigue, hard lumps around the joint areas. A doctor should make the correct diagnosis and prescribe a treatment regimen that will include changes to your diet. Treatments for high uric acid levels. The pain can be very bothersome, but there are certain things you can do to alleviate the problem, such as applying cold compresses to your sore joints. A doctor might prescribe non-steroidal anti-inflammatory medications that can be a huge relief. They may recommend starting medications at low doses and increasing them over time, as prescribed. Your treatment may take between 6 to 12 months. During this period you should take care of your diet and get light to moderate exercise on a regular basis. A sample diet to lower uric acid levels. Breakfast. 1 cup of skim milk, 2 slices of whole grain bread, mid-morning snack, 1 banana. Lunch. Gnocchi with tomato sauce, grilled corvine, white fish, flan. Afternoon snack, 1 slice of watermelon. Dinner. Eggplant parmesan salad made with tomato, carrots, and basil. You can mix the ingredients up however you like as long as you remember to balance protein, vegetables, fruits, and grains. Keep the fat content low. Remember, this article is intended to be informative and should not substitute for a doctor's recommendations. They may also recommend a different diet if your uric acid levels are well above normal. Take care of your health. It's the most important thing you have. No one but you can do this.